Hi there, it's Dr. Andrew Cohen. So breast reduction surgery, I see a lot of patients for this. It's become my niche, taking care of teenagers, moms, older patients, younger patients. It is a very common procedure, and everyone asks me, when is the ideal time for my daughter to consider getting a breast reduction? You really want to be at least minimum 3 years after a girl's first period, first menarche. And they've actually done a study to show that 3 years after the first menarche is a good time to start, minimum time to start thinking about doing a breast reduction where the breast will not grow after the surgery. So that's one thing. So yes, we have had 15-year-olds, 16-year-olds, 17-year-olds come and have a breast reduction and do very, very well. It is a 3 or 4 hour procedure. You do get a lift with a breast reduction because we're removing breast tissue from the sides and the top, and everything gets lifted. So every breast reduction does get a lift, and there is liposuction done on the sides because we want to really give the patients a nice round contour, because at the end of the day, the breast has to look aesthetic, has to look pretty, and has to look symmetrical. The recovery time is usually about 7 to 10 days, and we sometimes use a drain. Only about 10% of the time do people get a little drain, and about 90% of the time there's no drains. Depends on the ooziness or how it is in the OR. And I do perform this surgery as an outpatient procedure, so patients do go home after the surgery, and then we see you a lot after surgery to make sure everything's healing nicely. Thank you so much, and I hope this helps. Hope to see you here soon.